team that worked that we led, but we worked closely with our colleagues in South Africa. And then after a short break, we'll hand over to Joe Morrison to talk about the Pardhan project in Nepal. So there will be a short break in the middle. And the structure is slightly different for the two halves, and then we'll come together for a joint discussion. Without further ado, I'll pass over to my colleague Stephen Thompson, who's going to be the talk show host for the South Africa project. So he will explain how that's going to work. Over to you, Stephen.
Great, thanks, Mary. Can I have the next slide there, please? Okay, so it's a real pleasure to be here. So I'm a research fellow at the Institute of Development Studies, which is based at the University of Sussex in England. And we have a rich history in participatory approaches, participatory research, but also in reflective practice. So it's really nice to get the opportunity today. Quite often people involved in research are so busy dashing around, collecting data, analysing and so on, that we forget to reflect on what we've learned. So it's really, really good to get the opportunity today to lead this discussion about what we've learned from this programme. So very briefly, the study focusing on South Africa and the impact, socioeconomic well-being and human rights related experiences of people with disabilities in South Africa. So it was a collaboration. So there's three partners, the Institute for Development Studies, and then the National Council on and for People with Disabilities in South Africa, and the Human Science Research Council, also in South Africa. So three partners from slightly different backgrounds with different agendas, different ways of working and different structures, brought together under this funding from the UK Research and Innovation Fund. So we thought what we'd do today, instead of just having another presentation, which I'm sure a lot of people are sick to death of, especially over Zoom, we thought we'd try and do something a bit different and have a talk show or a conversation. So we have our colleagues. So we have Mary representing IDS. So Mary's got a camera on, and then we've got Tim Hart from the HSRC. And then we've got Tinashe Rubaba and Ntabi Singh Molongwana from the NCPD. And our colleagues Lebo's there as well. So Lebo, if you feel like it, feel free to get involved. If not, very good to have you as a member of the audience. Okay, so without further ado, I've got a few questions that I thought we could would at least get the conversation going. So it'd be very interesting to hear. So please do, for the panelists, please do jump in. So first, maybe could I ask, what did the research organisations bring to the partnership?
So who should start with that, Mary or Tim?
You can go, Tim.
Okay. All right. Good afternoon, everybody. I'm Tim Hart from the Human Sciences Research Council. As you've noticed, I have a bad habit of butting in. But without any further ado, thanks for hosting this session today, and thanks again to Vera for allowing us to do this, or enabling us to do this, and Stephen for taking on the role of the chairperson of the panel. I think just a little bit of sort of background. The HSRC is a National Science Council. We study many things, but one of the things we haven't done much research on lately has been around the topic of disability. We did some work on that in the early 2000s, and then key people left. So we brought on the expertise, I suppose, was fairly new. I am a person with a disability, but I haven't done a lot of disability work. A lot of it has been, or rather what I've done has been sort of literature review focused work and writing papers, newspaper articles and policy briefs and that, but really drawing on very small, low-key interviews and work like that. But now, one of the things I have a long relationship with NCPD, so let's start with that. I've known NCPD for about the past seven or 8 years. It might be even a little bit longer. And some of us were part of a small working group, and we decided that this was round about May. We decided that we should be looking at what the impact of this of the COVID-19 was going to be on people with disabilities in South Africa. And the intention there, quite simply, was to bring evidence to the fore that could be used for lobbying and activism by the NCPD and obviously others within the sector, although the main partner was going to be NCPD. So our role was really to develop some sort of, or the HSRC team's role rather, was to develop some sort of survey instrument and to sort of collect sufficient and focused evidence to do that. And I'm not going to take over what Mary will say, but we got involved with IDS in a kind of roundabout route, but that was particularly because we were looking for people, researchers who had a more global experience of the pandemic and the impacts of the pandemic, and we wanted to use that to sort of feed into how we would design our instrument that we were going to use on our online survey. And the whole reason really of using an online survey was just because of the ethics and government restrictions of doing research in times of a pandemic, and that's why we didn't do any qualitative work. But I think I'll leave it at that, and that was really the HSRC contribution, and I think bringing together NCPD and IDS together in the pool of 3 partners. I'll leave it at that, Mary.
Okay, so I'll just add on a little bit. I think that the contribution that we made was that we, as a disability research team at IDS, have done research about disability in a number of other countries. I had actually done some in South Africa before, but so it was interesting for us to contribute our experience of disability inclusive approaches and to sort of feed in our knowledge and experience about that, about how to make sure something like an online survey or any other method is inclusive, disability inclusive, because that, as I'm sure the rest of you will know, is something that's still very much emerging. Lots of people design things that aren't disability inclusive. So we had some ideas about that. So we were very involved in the initial design of the survey. Surveys are not our natural territory. We're much more qualitative usually, but we were able to advise about our knowledge about disability research from other contexts, and also around ethics, particularly because we've written rather a lot of disability focused ethics proposals in the last few years. So we think we've got that off to a T now. So that's what we brought in, the technical sides of the research process, I guess. I'll leave that there for now.
Great. And as you mentioned, you know, both the HSRC and IDS have done other research. You know, they're institutes that don't focus just on disability. Could you say anything about, you know, the experience of that kind of project management side of things as well, and what the representatives from the different institutes brought to the programme?
Well, I guess we tried to have, as we were leading, because we got the funding from a UK source, and so IDS was officially leading, but I hope we were a fairly flat hierarchical structure in the sense that we tried to share decision making around the three organizations and make sure that we did decide things together as far as possible. So trying to make sure that we did have meetings jointly, we didn't decide things on our own, so that if there was something that needed to be decided, we did have joint meetings on Teams, of course, or Zoom, and so we all brought in the knowledge and experience we had. So we'll come to the experience of the contribution of NCPD in a minute, but I think it was a real mixing of ideas, and each organisation brought with it their experience. So I think although we were officially managing the project, we hoped that we were doing that in a collaborative and equal kind of way. Maybe the others will say whether that was true or not.
Great, thank you. So maybe if we move the conversation on to OPDs, so organisations of people with disability, and maybe now if I could ask Tinashe and Tabby to come in as well. Could you tell us what did the OPD, or what did the NCPD specifically bring to the project?
Hi, Stephen.
Hi.
And good afternoon, colleagues. From South Africa, my name is Ntabise Molongwana, and I work for the National Council of and for Persons with Disabilities, with Tinashe and Lebo as my colleagues. With regard to the research in itself, we were excited because we felt like it gave us an opportunity to give what the experiences of people with disabilities on the ground is, or the experiences are. Because in many cases, you find mainly for us asking information from people that are, if you may allow me to call it, literate. But in this case, we also found ourselves going into the deep rural areas to be able to find what people's opinions are. And for us to enable us to do this correctly, we worked with IDS and HSRC on the language, the correct, or if I may call it, acceptable language to use, and the approach in which to ask questions in such a way that people with disabilities would identify, with the questions themselves. And then we also had a long discussions with regard to how to make the survey work for people with different impairments. In this case, I remember when we started introducing when we disseminated the questionnaire, we then came up with the idea, because in many cases, one would not consider that the questionnaire should not only be in a written language. So we made sure that we had a video that people that use sign language as their main area and their main language of communication can understand with an interpreter saying what the research is about. But for now, I'm going to stop here and just give my colleague Tinashe to continue with any additions that he has. T, over to you.
Thank you very much, Ntabi. My name is Tinashe Rubaba. I'm from the NCPD and I work with Ntabi and Lebo. Just to make a comment on that, we were very excited, as Ntabi has already alluded to, because in South Africa, there isn't really that deep interest in research in the disability sector. So this really came in as handy project to try to get a sense of what actually persons with disabilities are experiencing on the ground. And also research that has been there in the field has been targeted at organizations of persons with disabilities, not persons with disabilities themselves. So I think the strategy that we used on this research was quite authentic. Just to add to what we also brought in, accessibility in terms of the research instrument itself, the questionnaire, we tried to put out a sign language video to try to explain what the research is about. And in terms of rolling out the research itself, we had persons on the ground to try to assist, especially in cases where persons with intellectual disabilities, they needed someone to try to water down the terminology in the research instrument. Apart from what Tabi has already said, we have presence in all the provinces in South Africa. We have associations of and for persons with disabilities in all the provinces. And we have our own project, Casual Day, in which we have access to over 500 NGOs and special needs schools and private businesses, which all participate in Casual Day. It's a fundraising program for persons with disabilities. So with that network, we managed to reach to as much of persons with disabilities as possible. So I can say we really did bring a pool of persons with disabilities to be able to participate in the research. That's all from my side.
Great, thank you. Some really, really good points there. You know, obviously accessibility is so important, and language very, very important to get that right. You know, language can empower, but it can also act as a barrier. So it's really, really good to have that relationship to make sure that the research is appropriate and accessible.
Can I just add something there?
Yes, please do.
Yeah, so I felt that the benefit of having the national organisation in South Africa was that, I mean, at IDS we work in a lot of different countries, and the terminology and the usage around disability is different in each country. So I really learned quite a lot from our South African UPD colleagues about exactly what, you know, it's a terminology that I thought would work somewhere else, didn't necessarily work in South Africa. So we learned quite a lot about the nuance of language to use particularly in the South Africa context, because we didn't have that particularly.
Could I also come in, Stephen, with a comment?
Please do.
Yeah. So one thing that I found was extremely useful, and I think both Tinashe and Ntabi touched on this, is that the NCPD is a national organization, and they have provincial affiliates in most of the main cities in each of the 9 provinces. And this really enabled, although the survey instrument was sent out online and there was a web link to it, this really enabled a bit of a better, it wasn't just always a self-completed survey. Some people were helped where they needed help, and I think this was really a key thing. We aimed for, perhaps overzealously, we aimed for much higher number of people as respondents, but I think what we got was probably the largest response for survey on people with disability during COVID-19 in Africa anyway. And I think that's really, I mean, that's really thanks to the NCPD, in particular to our 3 colleagues that are on air at the moment, and also the director to Rena. And I mean, their networks really, you know, they really played a key role in not only getting the survey instrument out, but actually helping people to access the survey, both language, visually, everything. I mean, I think without NCPD, an organization like the HSRC, despite its long history of over 90 years of research in South Africa, I don't think it could have achieved this.
Can I also add something else I think the OPDs gave us? When we came to the analysis stage, which we haven't finished actually, we've only done the preliminary analysis, but we had some conversations all together as a team about the initial descriptive statistics about what seemed to be coming out. And it was really useful to hear the NCPD colleagues' interpretations when we were discussing, well, what do we think this means? And so it was really good to have their thoughts about what the initial analysis showed. And we will hopefully do a bit more of that, even though the funding's now run out. But we hope to do some more detailed analysis where we will try to do some of that jointly, so that it's not just the boffins trying to interpret things, but to really take it back to NCPD and see what they think is coming out. I think that participation in the analysis was an important thing.
Great. Thank you everyone for your contributions to that question. And just before we move on to question 3, I'd like to as well ask NCPD, Nthabi and Tinashe, just in terms of balancing your priorities. Obviously everyone's very busy, and no doubt this research forms only a part of day-to-day work. Could you perhaps say a little bit on the practicalities of balancing your commitment to this research, but also the other things you're doing?
Stephen, thank you for the question. And I'm laughing and I'm smiling because it was difficult. It was really challenging. And I think if anybody sees gray hair on Mary or Tim's heads, it must have been caused by us, because with all of the juggling and the work, it's not only research, and sometimes it gets frustrating when you know that there is a deadline that we need to meet, and again there's a client or clients that are waiting in the office to be assisted. So I really take off my hat to you, Tim, in keeping us in line and keeping us, making sure that we attain what we came up with. Even the 1,800, at times I would even be anxious, on what the numbers are, and be scared of looking at what the numbers are, because it was going slowly in the beginning, and things started to increase as we went in the middle of the time. But I really take off my head to HSRC and IDC.
Great, thank you, Nthabi. And I think it's important to recognize that, while many people agree that there's not enough research on people with disabilities, but during this period of COVID, there's been that extra pressure on the organisations working with and for people with disabilities to facilitate, network, and make sure this research happens. So I think that can't be stated enough. Okay, so maybe if we move the conversation on. So the third question we had was around the challenges. So what were the challenges involved in this research, and what did we learn from each other? Maybe Tim, could I start with you, please?
Yes, okay. I think Nthabi has mentioned some of the challenges. So my background has been working in the non-profit and non-government sector, and then also more recently, the past 20 years in science councils. And it was interesting to try to get a balance between knowing that the team was committed to the research, but also knowing that they had other pressures. So there was no doubt that Nthabi and Tinashe and Lebo, Lebo was always around for some reason. She would be sending me emails back and forth while Nthabi was out in the field and Tinashe was away. So there was that good link. So there was never a doubt, but there were moments of concern, if I can put it like that, because all I suppose you, Mary, and I had to do was really concentrate on the research and the quality of the research, and make sure that we were meeting the funders' requirements and so on. But I think it was, and what also was a learning curve was not only the fact that we were working with an organization that research is not necessarily their number one priority, was also working with people who themselves have disabilities. They are people with disabilities, and I think that to me was also, I mean, I know at times Ntabi had to be away due to her impairment on occasions. And it was just, I mean, we had quite a lot of telephone calls, Ntabi and I, during those times. And it was just interesting to learn more about what people with different disabilities face in almost everyday work. So I kind of almost had a parallel learning session as part of this process, learning the struggles that Ntabi was having, Tanashi, due to the physical impairments that they have. And they probably had a lot of challenges with me because I'm hearing impaired, and often I didn't hear what they were saying at meetings. So there were all these things, and I think that was something that we definitely learned. So there were really some key learning things here, not only the sort of tension between research and actual development or more development oriented work, but also the tensions of people with disabilities working, or different disabilities working together, and actually doing so very collegially, and acknowledging the challenges that we all had. I mean, it was a great experience in that sense. Let me leave it for there, and we can hear what other people, what their findings were, or what they learned.
Great. Thanks, Tim. Maybe Tinashe, could I invite you to say what were some of your challenges and what were your main learnings from the process?
Thank you, Stephen. Yeah, there was a lot to learn in the process. We did learn a lot from IDS and HSRC in terms of trying to really organize ourselves and working with deadlines. We had a lot to learn in that sense. And also we learned a lot during the survey instrument development, the questionnaire. There was a lot to learn in terms of that. We also did assist in terms of wording and terminology that should be acceptable within the disability community. So we learned there to try to sort of like balance what the research instruments call for and what would also be acceptable in terms of the disability side of things. In terms of challenges, we did have challenges on the ground, especially when it came to disseminating the questionnaire. I think Ntabi will touch a bit on that, but the length of the survey instrument, of course, the intention was to cover all aspects of what we wanted to get from the respondents, but then it ended up being a little bit lengthy, especially for persons with intellectual impairments. We find that Ntabi had to sit hours on end trying to make sure that we cover all aspects of the questionnaire and that all questions are responded to. So that also contributed to the challenge of the lengthy time that it took for us to get many respondents. There were also challenges, I'm not sure if I can use the word, a little bit of tensions. We have colleagues with hearing impairments in terms of the platform that we would use for some of our meetings. So they would want a platform which would use captions. So it was during the time of the pandemic and people were trying to change from your physical meetings to online platforms. There wasn't this much knowledge that was there, especially from the NGO side, in terms of which platforms would be really accessible to all persons participating in a meeting. So in terms of weighing, should we go for Google Meet? Should we use MS Teams? Which platform is really accessible and enjoyable for everyone? So we had those challenges. I think, Ntabi, you can add more.
Yes, thank you. Thank you so much, T. And I'm gonna take it from where you talked about the questionnaire, and as well as making sure that people understand the content. I found it challenging for me personally, and even when I observe other people, assisting people with intellectual disabilities to complete the questionnaire. And I'd be interested what researchers would say about this, because the questionnaire was long, fine, we acknowledge that, but the questions that we asked were we felt like it was important for those questions to be there. But with regard to the length of the question, a person that's assisting somebody with an intellectual disability, I am afraid that there is usually an influence from, an example would be from my side, assisting a person with an intellectual impairment. I would have to find a way that can be easily understood in terms of using the right language, or the simplest language that a person can understand. But at the same time, being a person with a specific position within a center, I am wondering whether the question that comes up, or the answers that comes up, is it just to satisfy the person that's assisting you, and so on. And it would be a real interest. And then the other difficulty was with looking at priorities. And I'm not talking, I know, Stephen, we've already talked about, work priorities and so on. For us, the research, our priority in entering, in being part of this research, was for the future, to know what other mechanisms, or what other efforts can be made to ensure that persons with disabilities are included. And that's in the main why we needed the research to be included. Whether it's food parcels, whether it's accessibility to water, and so on. So we were looking at the future and how to influence the government in terms of making sure that the discrimination or unfairness does not happen should other pandemics happen, or even going forward after we conduct the research. That's in the main. Also, I think Tinashe touched lastly now on the accessibility of making sure that certain people are okay with captions and others with sign language interpretation. And I want to really say that IDS, Mary, and HSRC, you assisted us well, because ultimately we had to contract somebody else that could assist us with the interpretation. And I'll end off here with regard to the answer.
Great, thank you. Mary, did you want to quickly?
I think they've mostly been covered in terms of people's time pressures and having to understand each other's roles. But I think we learned a lot from each other in that kind of way. I don't think I've got anything else to elaborate about that at this stage.
That's fine. We're quite short on time. So maybe if we just quickly move on to the fourth question. So if I could ask the four panelists just to respond pretty much in a one sentence answer, if possible. If you were going to do a collaboration like this again, what would you do differently, or what would you recommend to others? So maybe Tim, shall we start with you again?
You can start with me. One or two quick sentences. I think the planning and role of what people are going to do would need to be clarified. We did rush in. It was a kind of funny project, just because it would be sort of stop and start in terms of getting the funding, doing the questionnaire, that sort of thing. But I think in hindsight, we would probably, a key thing, and this is really from a research point of view, the first key thing would have been a much better piloting of the survey instrument. And then I think the other thing would have been perhaps, and Tabi has mentioned this, and I think perhaps our topic or our scope was a bit too broad. So we were looking at socioeconomic and human rights during the COVID pandemic. And perhaps one might want to have looked rather at access to, or rephrased it slightly and said access to government relief interventions or something like that. And that would have cut down, I think, the length of the questionnaire to some extent. So it would really, it would be those two things that I think in hindsight one would do differently. Team-wise, I don't think I could have got together with a better bunch of collaborators. I think we really all got on well. Everybody, did. I mean, it was highly intensive at times, but I think the results are good, and we'll be sharing more of those, as Mary said, as we go along in the next month or two.
Thanks, Tim. Mary, could I ask you in a sentence or two?
Again, I think Tim's just reminded me of what a rush it was, particularly at the beginning, and so I think. If we'd had a bit more time at the beginning to get to know each other more and to exchange ideas and understand what each other knew and what we could share with each other, more preparation stuff, we had to jump in very quickly. And so I think that kind of initial, if we'd had time to do some more initial getting to know each other and mutual training of each other before we actually jumped in, that would have been good.
Great, thank you. And Tinashe, anything you would have done differently?
Let me say what I would, let me phrase it as recommending what would really be beneficial to others. I would say involvement of persons with disabilities themselves, from the actual conceptualization of the research topic to development of the research instrument. I think that is very, very useful. And also, I can't really emphasize enough accessibility of whatever research methods that are going to be employed by for the research. So I think those two are quite critical, especially if you want to get authentic feedback from persons with disabilities.
Great, thank you. And Tabby, finally, last but not least, anything you do differently?
I would mainly get people to be able to answer the questions themselves. I know that is difficult, and that's in a perfect world, and we do not live in a perfect world. But we did well in making sure that we provide data, and or in the form of a time for people to be able to be onto the research, because in many cases, not a lot of people would have, not as many people would have been part of the research if we did not do that. And again, it's wonderful to, I know Tinashe talked about the methods, the research methods. It was a difficult time for us when we conducted the research, with the lockdowns, the change in lockdowns. So the consideration would be more that we ensure that each person has got a fair way in which they can get onto the survey and answer the questions themselves.
Great, thank you. So all really interesting answers. So we're nearly out of time. So just a few concluding remarks from me before, I think we have a short break before the next presentation, but there's some generic project points, I suppose, that the key to this has really been drawing on the strength of the different partners and trying to make sure that we're greater than the sum of our parts, which I suppose could be applied to any research project. But specifically with regards to disability, that importance of having the organizations of people with disability not only on board, but as equal partners and really leaning on them for their technical expertise the language, and as well as Ntabi highlighted there, just that the diversity. We can't treat disability as one thing, and there's different needs, different aspects to different impairments, and so on. And then while there has been challenges along the way, but from every challenge there's a learning, and I think it's really on us as project partners to make sure we document those learnings, and make sure that we get those learnings out there for other people to take up if they want. And finally, just a really interesting point I thought from Mary about the that we didn't really have much time to get to know each other, and of course it's quite hard to get funders to cover that, but it's an important aspect of the project, and of course it would have been really, really nice to get to know everyone a bit better, but hopefully there'll be time for that in the future as well. So thanks very much everyone for listening. Mary, I'll hand back over to you as the chair of this session, but thanks everyone for your attention, and to the panel for your responses.
Thanks, Stephen.
Thank you so much, Stephen. Thank you.
Great TV host. I think you might have a future as a chat show host somewhere. So should we just have a round of applause for Stephen's chat show host skills? Thank you. So that's the end of the IDS HSRC NCPD show. So now there's a short break. I'm not sure if it's 5 minutes or 10 minutes. Perhaps someone can tell us. Joe, what time would you like to start? Oh, is Joe there, or Saga? What
she's
time?
Muted. She's not aware she's muted.
Oh,
Yeah, I think.
Oh, hi. What time would you like to start, Joe? 5 minutes or 10 minutes?
5 minutes is good for us, I think.
Okay, so in 5 minutes time, if everyone would like to come back, I will stop sharing these slides, and we'll be turning over to Joe, Saga and colleagues. Okay, so see you in a few minutes. Thanks everybody. And then after Joe and colleagues, we will have a joint question and answer session. Thanks, folks.
Thanks, everybody.
So hi everybody, welcome back after your 5-minute break. I hope we have everyone here still. I'm just briefly going to let all of the presenters introduce ourselves. So my name is Dr. Joanna Morrison, and I work at the UCL Institute for Global Health, but I'm based in Nepal. And I've been doing this project with a very large team of people, and I'm really happy that Sagar Prasai and Sarita Lamitani are going to present with me. So Sagar, maybe you'd like to say hello to everybody.
Yeah, hello, namaste everybody. I'm Sagar Prasai from Kathmandu, Nepal, and I am from an organization called Diverse Patterns. We do a lot of work on diversity and inclusion. And it was great to work with Joe and all Kathmandu University and other at our teams. And I am a person with disability myself. I use a wheelchair for my mobility. Sarita, I'd like to pass this on to you. Hello, Sarita.
Hi, I'm Sarita Lamichhane. I'm the founder of Prayatna Nepal. I'm visually impaired myself, and I'm so happy to connect with this team, Pardhan team. Thank you.
Thanks very much. So I will take you briefly through our rationale and objectives before we move into how we engage with OPDs. So Sagar, can you move to the next slide, please? So our study, the rationale for our study is basically that adolescents, that's those aged 10 to 19, have unique experience of COVID-19, but their experiences are rarely documented. And we know that because we did a scoping review of the literature, and we found only 30 studies which had taken data from adolescents and presented data about adolescents. We looked at grey and peer-reviewed literature and found that most of that literature actually didn't engage with adolescents themselves as participants in the research. So we wanted to capture their experience, but also to acknowledge that it's really important they participate in the design of tools and methods to collect data. So we did a study with them to develop those tools. Next slide, please, Sagar. So the objectives of the study were to understand adolescents' experiences of the pandemic in Nepal, in rural Nepal, and to develop research methods and tools with adolescents to increase their participation in research about the effect of COVID-19. Next slide, please. So we engage with organizations of persons with disabilities in several different ways. One of the ways that we did that was through engaging with partner organizations in the 2 districts where we did the research. So that was the Disabled Association in Magdi and the Association of Disabled Women in Udaipur. So we engaged them so that we could try and recruit local researchers who optimally would be people with disabilities themselves. We also needed their support to locate and enable access to the adolescents that we wanted to do the research with. And then when we had recruited researchers, those organizations helped us orient those researchers with the field context and introduce to participants often, and they provided support to researchers in terms of transport, finding out how to hire a motorbike, for example, and also where they would live, their accommodation, because although they were from the area, one of them was from the area, she still needed help to find somewhere to live. And then also build that trust with participants. We also engage with those local level OPDs to disseminate the results of our study and have some local level dissemination. But what we're going to focus on today in our presentation is how we engaged with OPDs through our advisory committee. We had a committee of several organizations. So I'll just read them here to acknowledge their involvement. So that was the National Federation of the Disabled, the National Disabled Women Association, the National Federation of the Deaf, Nepal, Resource Centre for Research and Development, Parents Federation of Persons with Intellectual Development, and Prayatna, Nepal. I'm sorry, Sarita, I probably said that very badly. Okay, next slide, please, Sagar. So would you like to take over from here, Sagar?
Yes, thank you very much, Joe. Sorry, I think we'll move ahead. Yeah. So as Joe discussed, we are going to talk today more about the engagement with OPDs, especially as in the role of advisory committee. And so the advisory committee was more of a like steering body of our whole research, and we were in touch with them, or we were working with them even before the research actually started in the ground, like when we were preparing the proposal. So these were the people who helped from that time for us to prepare our planning and select the districts where we can do the research and those things. But regarding the research itself, and regarding the project itself, so we mainly worked with advisory committee in 3 phases. So in the first phase is when we were just gearing up to start and implement the project. So that's what we call planning phase, and we did a first meeting with them, all 6 of our advisory committee, and in that meeting we took their guidance for ensuring the diversity of respondents on who should we reach out to, and they told us like not to leave the hardest persons with, because there are a lot of research and a lot of surveys, including the people with a moderate or mild disability, but then they guide us to target people with severe or complete disabilities in this research, and we did exactly that. So in that research, in the first meeting, it was mostly on the research plan, how we can reach the target groups, and then also because we were also doing the scoping review, they helped us in locating what we call a gray literature, which was generated from their own organizations or their partner organizations, or or their networks, because these were mainly huge national organizations. So after this planning meeting, we went on to do the data collection at one end, and also on the other hand, we did a scoping review, right? So in the scoping review, or when in the implementation phase of this research, we again had work, or we worked with them again in the form of a meeting, and we call that implementation phase. So in this phase, they helped us, the advisory committee helped us to coordinate with the local government, because ours was not an online meeting or online data collection process as discussed in earlier presentation. Ours was more of a visiting person's house in the time of COVID with a lot of precautions. So we need to coordinate with local government, DPOs, and other local stakeholders there. So the advisory committee helped us in doing that. And also, they provide, we had already completed our scoping review in this phase, in the second phase, and they provide us different feedbacks in that our scoping review. And they also told us even in the scoping review, it's very much essential to report on the impairment type because we reviewed many different literatures. So, but there was not in lot of those literature, it was not clearly mentioned who were the respondents, what were their impairment types. So our advisory committee guided us to find such kind of literature which also differentiate between the impairment types, so that it's clear whose experience are we talking about in the scoping review. So that those were the kind of critical feedbacks, inputs we received from the advisory committee on the second phase, in the implementation phase. And then after the research and when we were doing the preliminary analysis of the data, or we were just starting with the data analysis, we did after the data collection process, we did another meeting with them, and in that meeting they basically helped us in providing and guiding us what to present as a recommendations in our report, and to whom. For local government, for NGOs, INGOs, they provide us, don't miss this thing. So because they had those kinds of a practical knowledge or practical experience of their advocacy, they guide us on those things. And also they helped us in validating the data, validating the research findings, and it was exactly the same, because they were advocating from their experience, and we were bringing out the same results based on our data, based on the academic research. So when we triangulated those things, it was exactly the same, and they were very much happy about our findings, because it echoed with what they were advocating for in the local level, or in for the inclusion of persons with disabilities in these kinds of disasters like COVID. So, and also they suggest us to disseminate the tools, because we were working with an innovative tools, dolls and pictures, to work with persons with different forms of disability so that they can express themselves. So our advisory committee helped us in bringing out those tools to mass, and then disseminating the results in the form of webinar. Also, they suggested various different national and international organizations whom we should not miss out in the webinar, this third phase. So that's basically how we worked with the advisory committee. And so how we select this members of the advisory committee is, mostly these were the national organization representing different impairment types, which we call thematic impairment types also in Nepal, mean disability types. And but not only that, they had some form of experiences working with researching with adolescents and also with girls and boys, and then they had experience of working with different impairment types as well. And most of all, these people all had networks in rural areas. So that was also one of the criteria for bringing them on board as in the form of advisory committee. And they also, because they were all the national level organizations with local networks, local chapters, they work well with each other, and that also helped us a lot to make this project successful. And lastly, I want to quickly present what is important in engaging OPDs. So we all who are present in this meeting, we all acknowledge the importance of including persons with disabilities or OPDs in any of the work we do on disability. Like nothing about us without us is an ongoing theme slogan for disability rights movement. But how to work with OPDs, or how to engage OPDs, is also very important, as much as why. So the main points that helped us to make engagement with OPDs successful as a form of advisory committee in our project is we regularly communicated with them, and we interacted with them, not only in these 3 meetings, but since I am also working on disability, and I am a person with disability myself, and have been working with these people in the past, I had a regular interaction with these people, with these members time and again, and then we address their feedbacks, we acknowledge their inputs, and we change different things according to their remarks or findings, and that helped them to feel the ownership of the project. So that's why they were very much motivated and engaged with us. And also when we share, because we make transparent, we make our finding transparent, we share with them and then validate with their experiences, with their work, because this was not the only work they were doing. There are a lot of different projects in these places and all over Nepal. So we did validate our findings with them. So they were very happy with our findings. Also, learning and experience sharing, because these people have been working for a long time in disability, especially in in the rural areas, in the form of research and other work, other advocacy work. So it was both a learning for both parties, for us as the researchers and OPDs, to bring out the best way to include persons with disabilities in the project. So these are the things that made it successful engagement for OPDs, according to us, according to Joe and me as a project team. But we also have Sarita with us. Sarita is one of the member of advisory committee. She is leading an organization called Prayatna Nepal, and she will also share her experience quickly. But then before that, I'll just acknowledge this acknowledgement slide I'll read out. And so the research team was Dr. Joe Morrison and Sarah Wong for the Institute of Global Health at University College London, Dr. Neeraj Paul and Mr. Dipesh Khadka from Kathmandu University School of Arts Disability Research Center. And from our organization, from Diverse Patterns, we were Sagar Prasai, Neer Shrestha, Shraddha Pokhrel, Insa Poon, Susmita Singh. Insa and Susmita were our field researchers in Magdi and Udaipur respectively, and Sabina Lakha was our event coordinator during the dissemination, which was also a very successful event. And then from IDS, which you just heard before our project, Dr. Mary Wickeden and Brigitte Rohwelder. And the film, we made a film also, hopefully you can look at that. We'll share that in the chat box or in another sessions also. So that was made by Dinesh Devkota for Media for Development, and our partners, as Joe mentioned, are Disabled Association Magdi and Association of the Disabled Women in Udaipur district. We also thank all the 6 advisory committee members who were based on Kathmandu, and all the participants, their family and friends who actually helped make this project successful. Now I'd like to bring on Sarita to share her experience on what worked well as an advisory committee member, or what we could have done better. It's her experience of being on the advisory committee.
Thank you, Sagar sir. It was such a nice opportunity to connect with this team as an advisory committee member in the Pradhan research team. First of all, it is the win-win situation for the organization of person with disability, and as well as the academician, the researcher, because in the in the disability sector also, that there are so many research done by the organization of person with disability, but that are also not reaches with the academician or a different target group. And from that initiative, we got we are an academician and the advisory, the leaders from the organization of the person with disability and the diverse group are in the one place. So it was a so better place to share our idea and to gain knowledge on the different dimension of the disability inclusion, as well as the different dimension on the inclusive research. Second thing is, the good thing is the accessibility. The accessibility is the precondition for the disability inclusion of the person with disability. But the majority of the case, the accessibility only considered with the ramp. But the accessibility is huge, and that during that meeting we got opportunity to make a realization of the importance of accessibility to the whole research team. Also, the good thing is that they consider accessibility as a precondition during the working period. And third part is in Nepal, as well as the most of the developing country, the disability are marginalized, and it gives the opportunity to connect with the marginalized voice through the organization of the person with disability. And then from our Sagar.
We've lost Sarita, I think. We're having some problem with our internet in Nepal today. We spoke earlier.
Yeah, okay. Sarita, are you here? I think it's connected. Okay, I'll quickly like to add, if she comes or not, or otherwise, I'll just quickly like to add that as Sarita was also saying, when like everybody says, including persons with disability in the project is good, and then it's beneficial, but they don't consider basic accessibility measures, as Sarita was saying. For example, in Nepal, I myself am invited to become judge, and then also in the advisory committee or a steering committee of these kinds of projects who are led by non-disabled people, non-disabled organizations, and then they organize the meeting in the 4th floor or the 5th floor. As I use wheelchair, they don't realize how one of the members is going to come up here in the meeting. So these are the small things. Like, for example, they might organize a meeting that is 4 hours or 5 hours long in a place where there is no accessible restroom for me. So that are the cases that's basically going on with what we call mainstream projects, and just touching on disability OPDs, but they don't consider those kinds of accessibility measures. But in our project, we were very much aware of those things, and from the very beginning we had separated some budgets for the disability accommodation, both for our advisory committee members or for the respondents who used sign language or captioning in or note takers. Also in some cases we had budgets for someone who could interpret the speech for those who had cerebral palsy or those kinds of disabilities. So that's also one way which makes working with people with disabilities or OPDs successful, by considering all the accessibility needs of the person themselves. So that's a quick thing that I wanted to share.
Thank you, Sagar. I think Sarita has managed to rejoin us. Please,
Sarita, are you here?
go ahead, Sarita.
I'm not sure from when I was caught up, because I was speaking. Finally, I realized that I was not in. Okay. Thank you. Probably, I don't know. I will start from the.
You were saying about the third part.
Okay. Accessibility. Okay, I think the in third part, in the accessibility part already Sagar sir mentioned, but in terms of the accessibility also, this research, this team, because they consider the accessibility as the precondition, because the document which was provided in the easy to read format during the planning and the implementation phase, as well as the fourth thing is, in the context of the Nepal and in the context of the developing country, around the world, disability, the community is considered as a marginalized group, and then the connecting with the advisory committee or working with the organization of a person with disability will provide the opportunity to convey the real situation or convey the real message from the marginalized community. And then fifth, why it is important, because being an advisory member of this research, what I realized, because the mentoring the other group who are interested to work in the sector of the person with disability, because sometimes we got to know there are so many organizations and there are so many sectors who are interested to work on the issues of the person with disability, but due to some let's say I must say, due to some phenomena, it is not mainstream effectively. But if we connected with the group of the advisor person with disability, it will be easier to. It will create the good platform to connect with the different people within a community. Lastly, because this connecting with the as an advisory committee of this group, we are able to prove in the society disability does not limit the possibility. Thank you so much.
Thank you very much. I'll hand over to Mary, who's our question fielder, I think.
Okay, great. So thanks very much, folks from Nepal. That was very interesting. Seemed like there were some overlaps and parallels with what the South Africa project was talking about. So I'm just scanning down the chat box. There was a question earlier, but I think Tim Hart responded to that one, and I'm just scanning along your pictures to see if anyone has their hand up. So I can't see any as yet, but would someone like to kick off for a question with a question? Either unmute yourself and speak or type in the box, whichever you prefer. And the question could be to one of the teams, the South Africa or Nepal team, or it could be addressed to everybody on the panel, and we could see if it's a more general question about OPD collaboration. Anybody like to kick us off? I'm just scanning to see if I can see any.
Mary, it's Tim. I wondered if I could just quickly elaborate on what we had tried to do with our survey. We had a feeling at the beginning of the work, probably going back to around about mid-July, August 2020, that the future of research in the world, because of the pandemic, might be that a lot of the interviews, surveys, etc., would be online. So we were trying to initially establish a link that would be data free. So anybody with a cell phone or tablet or something that could, in other words, even if they didn't have data, but it was switched on and it had the capacity to link to a network, would be able to go through the service provider that we had identified. Anyway, that failed, but so we ended up paying people almost directly into their bank accounts, not quite, or reimbursing them. But I think the future of the world, if we remain under severe lockdown as we do in many countries. I mean, I'm sitting in England now, and it's very different to South Africa, where we still have to go outside with our masks, and there's still quite a lot of what I would call sort of an emphasis on this lockdown regulations. But in the future, it really would be a good idea or a good possibility if there were these free platforms where anybody could actually just go without data, but as long as they had a device and they could actually then link into an interview or into a survey or something like that. And that was what we really tried to do, but it didn't work. It didn't work at all. Our service provider let us down terribly. I mean, they came. We were supposed to launch our survey in March, and I think in January they came back and said, "Oh, we can't do any of this." Anyway.
Okay, thanks, Tim. I think there's another whole debate about the pros and cons of online research, aren't there? And certainly different things have been done. The South African one was a mainly quantitative study, but we've also done at IDS, we've done online qualitative work, and it all has its pros and cons, I think. But any questions from anybody else? I still don't see any hands or anything in the chat box, but we have another probably 8 or 10 minutes. So if anyone can think of one. What's her? Jill Porter. Can you elaborate on the relationship between the data being exactly the same as the experiences of the advisory committee? Was that something that Sarita said or Saga said?
Yeah, I'd like to take that. So it's maybe my English, give away. So it's not like exactly the same. Means like I was referring to overall experience. For example, a lot of our advisory members and DPOs in the national level or in the local level, even without this kind of participatory research, we're advocating, saying there should be a better response, better disability inclusive response for COVID, and persons with disabilities, their families are losing jobs, and they didn't have the data, but then with the experience, long experience, they were advocating these issues. But when we came back and did the research, with these same people, Mary, you were also in the team, so we did exactly find the same thing. The father of a child was losing jobs, and then the family was disregarded by the community, and those kinds of things. So that means even without the data, when we say people with disability are marginalized, I can say it from my experience, from being adult, or like from being growing up with a disability. I can say that persons with disability are being marginalized, and but I don't have that kind of data to prove that, right? But if somebody comes, like for example, if Joe then researches with many people like me, which uses wheelchair, using her research method, and then come back to me saying, "Oh, Sagar, you were correct. Like many persons with disability actually are marginalized." So that's exactly the same experience that I wanted to share, but it's not like exactly A is equal to A or B is equal to B. So sorry, it might be confusing because of my English.
I think we've found, certainly at IDS, we've done 3 different studies with different methodologies, and we've found that in different countries, 6 different countries, and remarkable parallels and similarities across. These are African countries and Asian countries, remarkable similarities. Obviously, there are some contextual specific things, but the thing of people with deaf blindness or learning disabilities feeling particularly isolated, or people who need physical support, like somebody who's blind who needs to be led, finding that nobody will lead them because they don't want to touch them. We've found that in different countries, that people with intellectual disabilities sometimes found it hard to understand what was going on, and that the explanations were not easy for them. So those some of those impairment specific things were very common across different places. But of course, we also have to acknowledge that in none of these studies did we directly compare between people with disabilities and without, because it's also true that a lot of the experiences that people describe are ones that non-disabled people had too, feeling bored and scared and frustrated and losing jobs. So some of the experiences certainly cut across populations, and some of them are very disability specific. Okay, I'm just waffling on to fill in time because there doesn't seem to be another question. I'm just scanning. I'll just scan the participants again to see whether anyone. There's nothing else in the.
There are a couple of questions in the chat.
Yes, in South Africa, did you address a variety of languages?
The answer is no. The survey instrument came out in English. We didn't. I really can't. I can't give a good apology as to why we didn't do it in any of the 10 other official languages, but it was more or less agreed that that is what we would do. It didn't seem to be a challenge, except that one possible thing that I noticed was that many of the respondents seemed to be slightly better educated than the general population, but otherwise the dynamics or the sort of poverty levels, gender, race, that type of thing all seemed to be pretty similar. But there was this, it was slightly better. The sample was slightly better if we were looking at more educated, a higher number of more educated people within this. But then remember, it was voluntary, it was selective, it was going out on the internet. There were all those things which, of course, excluded certain people, such as very elderly people, people with limited experience with IT equipment. So we had all these other obstacles as well, or challenges. So I think that was one of the reasons why we just decided to stick with English as the medium. And it was agreed amongst everybody that that was fine.
Okay, thanks, Tim. We've just got time for one last question before we need to finish. And that was from Hanane. What was the impact of this partnership on decision-making in terms of policies and procedures? So I think that's a question we'd have to try and answer very quickly, about whether the findings from either of these studies are going to have an impact on policies and procedures, and what that might be. So Joe, do you want to, or Saga, do you want to talk about where your findings are going to go?
Joe, do you want to...
Yeah, go ahead, Sagar.
No, if you want, then please.
No, I was actually thinking about the question in terms of while we were doing the research. So what was the impact of the partnership on the procedures while we were doing the research? And I think several things that Sagar mentioned already was that, you know, a few things that we had thought about already were not approaching kind of easily found persons, adolescents with disabilities. The advisory committee was keen. We spoke to those who lived more remotely and outside of Kathmandu particularly. And I think Sagar has also talked about sort of what we reported in our scoping review, that changed also, and they did input particularly on our sort of procedures in terms of making sure that that the research was inclusive. So that was, you know, from while we were doing the research. I don't know, Sagar, if you have anything to add to that.
I think we are officially out of time now. Sarah has told us to finish at 5.
Yeah, okay. So no, that's all right. So I think we'll have some of the policies impact from the local dissemination, because the local level bodies were also keenly interested, and so we can expect to see the positive results from there. Thank you, Mary.
Okay, I see one more question from Avita, but I really don't think we have time to answer that about measurement of poverty. So we might have to close it. If you're interested, you might have to email the researchers or look for the publications on that. Oh, Tim's answered part of it for you. Okay, so thanks very much. Fantastic, great discussion. And I think we now need to go to the next breakout session, which starts at 3. So you have 3 minutes to get yourselves to wherever you need to be. Thank you very much, and a round of applause for everybody.
Thank you. Bye-bye.
Thank you.
Thank you.